can I tell you both, the worst part of it all is probably the hot flashes when you're just sitting and you're just sweating and you can't control it.
Welcome to Healthy Living, Wellness and Prevention, Medical Innovation, the Informed Side of Care. Welcome to Baptist Health Talk.
Hi, everyone. I'm your host, Johanna Gomez. Welcome back to a new episode of Baptist Health Talk, where we answer your most searched questions on trending topics. Today, we're talking about a hot topic, menopause and women's health. And we're joined by Dr. John Paul Diaz, Chief of Gynecologic Oncology at Baptist Health Miami Cancer Institute, and Dr. Alejandra Angel, OBGYN at Baptist Health Baptist Hospital. Thank you both for being here, for answering all the questions that we have, but also to continue this conversation that so many women are talking about, especially we've been noticing on social media. It is a talker, but let's get to the basics of there's a difference between menopause and perimenopause. So Dr. Angel, I'm going to ask you if you can please describe and tell us the difference of perimenopause and menopause.
Yes, and thank you for inviting me to the podcast. Definitely a trending topic. Women and in general, we're all living longer, but we also want to live a good quality of life.
Yeah.
So I think that's why this is coming up. The term perimenopause refers to the time when the changes start, more noticeable when you start having changes in your menstrual cycle. And this can be also in conjunction with the onset of changes and new symptoms that people most of the time relate to menopause. Then perimenopause can last many years and usually ends with a year after the onset of menopause. The term menopause is defined as a cessation of the menstruation 12 months after the last period.
Okay. So when does perimenopause start? Is it an age thing or is it a way of life? Can you push this along a little bit farther in life?
There's a lot of factors that go into it. I'm going to say most likely genetics has a role in it. And most commonly, it will start in your 40s, although some women can start having changes in the late 30s. But usually, because menopause average age is 51 to 52, you can have perimenopause even like average 7 years before that.
Okay, so how do you officially know when you are in menopause?
When you haven't seen your period for a year.
It has to be a complete year in order for you to say that you are officially in menopause. Okay, there are so many symptoms that we hear about, hot flashes, to not being able to sleep, mood swings. Are those part of menopause or perimenopause?
They are actually part of both, because even though you're still having your menstrual cycle, you can start experiencing the night sweats and the hot flashes that could also affect your sleep and all of the other symptoms you mentioned, mood swings, irritability, anxiety, depression, brain fog, and the list goes on and on.
Nothing exciting. You haven't said anything that any of us want to actually deal with. And unfortunately, Dr. Diaz, something also in the headlines that we've seen is menopause and the risk of cancer. Are they correlated?
They're not necessarily correlated. We know as we get older, we're at risk for more cancers. And so menopause happens at around the age of 51 in the United States. And as we get older, that's when we start diagnosing these cancers. So I think the important part, is like Dr. Angel alluded to, is you're going to start to feel these changes. There might be something subtle, just like more frequent headaches. You know your body best. And as you start to experience these things, relay this to your gynecologist, your primary care, and you might be entering this mysterious perimenopause. But once we identify, we can then find ways to help you manage these symptoms and how to work through these things until we get into menopause. So there's not a direct relationship, but once you do enter menopause, as we said, you shouldn't have your period for about 12 months. If you do experience any abnormal bleeding after that, you need to report that to your gynecologist. That may be a sign of something going on from a GYN standpoint, like an endometrial cancer or a cervical cancer. So it's not necessarily menopause associated with, but more cancer become common as we get older.
Right. So something just to keep in mind and to look for. You said something interesting that in the United States, it's the age is 51. Does it differ in any other countries? Why or not?
Yeah, as Dr. Angel explained, I think part of this is genetic. Part of it is environmental or diet, right? In the United States, we're entering into menarche earlier. So it used to be that women, girls would get their first periods at around the age of 14 and 15. That's now been moved up, 11, 10.
Yes.
And so the earlier that you start, probably the earlier you're going to get into menopause, but we're seeing that last longer. So all these things touch upon it.
Okay, but you just mentioned the young girls with getting their periods at a younger age, that what we have been known or we've heard of. Does a lot of it have to do with environmental, maybe what we put in our bodies, or something going on that has changed from the past 20, 30 years, that there's a shift?
I don't think anything specific necessarily, like when it comes, for example, to our diets.
Okay.
But yeah, we know that, diet can change from one country to another. And perhaps that could have an impact in the age of menarche and then subsequently affect.
Right.
But another thing that's very common is to more or less you can predict when your menopause is gonna come based on what your mother or your grandmothers, at what age they went through it.
Okay, so just so we could be clear, there's a difference between perimenopause and menopause. You can be in perimenopause, like you said, for 7 years, live with all these side effects, but you guys can help us live through it and maybe a little easier. What are some of the things that you guys can provide for us that we can live a smoother life with the hot flashes and the mood swings and the anxieties?
I think it depends on what's the goal. What's the symptom that we're trying to alleviate? You may be going through perimenopause, but it really is not having a detrimental impact on you.
Okay.
Some women go into menopause smoother than other women. So it's really symptom-based. What is it that's bothering you? Is it the brain fogginess? Is it headaches? Is it vaginal dryness? And how can we adopt these things? And sometimes we use non-hormonal options. And sometimes there might be a role for hormones. So again, it really leads to a conversation with your gynecologist, your primary care physician about what is it that's bothering you about these perimenopausal or menopausal symptoms, and what's the best strategy for symptom relief.
Once you're in menopause, does it kind of just even out a little bit and everything just goes away and you can kind of live your life at a little bit more ease, as they say?
Most commonly, and just like Dr. Diaz mentioned, I think that the key here is that it's an individualized therapy, and that ideally you seek the advice of somebody that is familiar and comfortable treating perimenopause and menopausal symptoms. So sometimes can be intertwined and be the same, or they could be mild, they could be severe, they could be affecting your daily routines. So basically, it definitely has to be very individualized. During the perimenopause, some people can call it, a sort of chaotic hormone imbalance, or, for lack of a better word, fluctuations are more noticeable. And then once you are in menopause, because your hormone overall declines, then sometimes these symptoms, most commonly vasomotors like hot flashes and night sweats, can eventually disappear. But it can take for somebody, just a few years in the transition, or some patients, a minority of patients can be having hot flashes for a longer time.
Right. Dr. Diaz, once you have hit that menopause stage, do you have to get mammograms and pap smears? Absolutely.
Nothing changes. Once you go into menopause, you still need your relationship with your gynecologist and your primary care physician. And a lot of times people think, well, I'm in menopause, I don't have to see my GYN. Or sometimes if they lose their partner, I'm not sexually active, I don't need to see my GYN. And always reinforce it. You still need to see your GYN every year. You might not get a pap smear every year, but every year you need to see them for wellness checks, evaluations, up-to-date screening, be it mammography, colonoscopy. So all these things are important. By no means, once you hit menopause, are you done seeing the gynecologist.
And it's interesting, you also said you don't have to see your gynecologist every year. Is that something that has also changed?
So you still got to see your gynecologist every year. You just may not need a pap smear every year. And that's between you and your gynecologist based on whatever risk factors, your previous pap year history. But again, just because you may not be getting a pap smear doesn't mean you don't need to see your GYN.
So I just have to make sure to write down that I have to go see
every year. You can't escape.
Because, that was very confusing. Oh, you don't need a pap smear. So do I need to go see my gynecologist? And you're saying absolutely. And
Absolutely.
Yeah. Okay. Add that to my list of things to actually get done. HPV vaccine also has come into play. If you are on the younger side, a lot of us did not get vaccinated, did not get the HPV vaccine. I did it myself, but so what do you do with the HPV vaccine now at an older age, prevention for cervical cancer?
So it's a great question. So the HPV vaccine is approved right now up to the age of 45. And so as we talked about earlier, some of these women may already be experiencing these perimenopausal symptoms.
Right.
So we tend to still ask about it. Once you're in menopause, the value of the HPV vaccine at that time is unclear. But certainly before the age of 45, if you haven't yet been vaccinated, something to discuss with your gynecologist and your primary care doctor. What are the benefits still at this age?
So after the age of 45, you can still get the vaccine?
After the age of 45, we don't have a lot of data on it, and it's not FDA approved beyond 45, which is not to say if you have certain risk factors that it may not be of benefit to you. We just aren't sure.
What can we do at that moment? Like what's next for you if you are 45 and you do not have the HPV vaccine then?
Well, you need to see what are the risk factors. Are you still in the same monogamous relationship as before? So is there other HPV exposure I may be concerned of? Do you have a previous history of abnormal pap smears or HPV infection where, again, there might be benefit? There are emerging studies to say that HPV vaccine is not only helpful to prevent these, but maybe of a therapeutic benefit. So it's really a one-to-one discussion with your gynecologist, your primary care provider. What would be the value beyond the FDA recommendations?
Okay. There's also some other things that we have to deal with. Unfortunately, the weight gain, osteoporosis is one of them. What can we do? What should we be aware of?
Yes. So it's important to, like I said, individualize your risk based on your family history, based on your own medical history, to come up with an educated and informed decision when it comes to the therapies that are offered, whether you're a good candidate for hormonal therapy, and besides just to treat your symptoms, would it benefit, for example, prevention of osteoporosis? If you have a very strong family history of, women in your family having hip fractures that impacted their quality of life, and then do you want to try and prevent that and avoid that? So that would be another reason besides your symptoms to go on estrogen therapy.
Okay. There has been so much research that has been done with menopause, and osteoporosis is one of them that they actually just linked it just a couple of years ago. I believe that there is a link with this. What if you are already in your age and you're older and you have osteoporosis? What are the things that you can do, or you can guide us as to what we can do to live a easier, smoother life?
I think there's prevention and then there's treatment.
Okay.
If you want to prevent it, usually you should start before the onset of menopause. And what we know is that daily supplementation with calcium and vitamin D, and focusing your exercise routine more on strength training, because one of the things that we lose as we age and we enter menopause is our muscle mass. And keeping your muscle mass will also indirectly strengthen your bones. So that's all in the prevention part. When it comes to hormone therapy and prevention of osteoporosis, the same thing. When we're depleted of estrogen, when we enter menopause, then that can impact the bone remodeling. And going on hormone therapy is another way of adding to that prevention strategies to avoid the acceleration of the bone loss.
Now that we're talking about hormone therapy, what if you had cancer in the past? What do you recommend to a woman that is her diagnosis?
Again, it will depend on the type of cancer. Not all cancers are going to be hormone dependent. It's like everything, you would have to assess what are the risks and what are the benefits of this particular patient going on hormone therapy. Having said that, there's luckily also even FDA-approved alternative medications that are non-hormonal to treat the symptoms. And patients that are cancer survivors are usually more studied in this arena because of possible contraindications to go on hormone therapy.
Okay. It also sounds like we lose a lot. And one of those things that we lose is also our sex drive. What can we do at that moment?
And that's usually a complex and multifactorial causes for this. Starting with one of the common symptoms of vaginal dryness that can in itself affect your sex drive.
Right.
Because then if intercourse becomes painful, eventually over time, you're not going to have the desire to do that. So I think that it's not one solution to treat, and addressing your vaginal dryness can help. But, it's all about the context. A lot of women in perimenopause are also going through changes in their life, in their families, kids going away, maybe even some struggle in their marital relationship. So we can't forget about the psychosocial component of it.
Yeah. Holly Berry, she just came out this year, just a couple months ago. Bashing is not the word, but she came out telling her story on how she went to her doctor, and he said that she diagnosed her with herpes, and she was really going through menopause. And a lot of it just took storm, that conversation of how doctors are treating women. How does that even happen? Can you both explain and give me your opinion on how something as herpes and menopause have somehow been in the same boat as that they diagnosed her with?
So I can't comment on Halle Berry and her gynecologist, but, she came with symptoms of vaginal dryness and painful intercourse. And it seems like she was maybe misdiagnosed. But I think like Dr. Angel's talking about, you need to report these symptoms to your gynecologist and your PCP, and you know your body best as to what's going on. And it may be multifactorial, she said. So there may be some issues with libido because it's painful because of vaginal dryness, or there are other things going on. So it's nice that we're having these things so we can start these conversations. A lot of times women and men are embarrassed to talk about sex life or problems in the sex life. Mm-hmm. And so it's great that we have these forums where we can bring these things up and people can at least start this conversation with their providers. And oftentimes it may take more than 1 or 2 visits to their physician to really identify what is the problem and how we can treat that to get on the other side of this. But in the past, people were shy about talking about this. Even in my office where I deal with a lot of cancer patients, we know that sex is a big part of a marriage. And oftentimes after a cancer diagnosis or certain cancer treatments, they may have difficulties. And if we don't bring it up, sometimes patients will be very shy. They're focused on their cancer treatment and cancer diagnosis. They may want to address the part of their intimacy. So it's good to have these conversations. And oftentimes it may take more than 1 or 2 visits to figure out exactly what's going on and how best to, again, address the symptoms, how it's impacting that patient.
But do you feel that the conversation is shifting because a lot more women are coming out saying, no, I am going through menopause, or they're giving it more attention, I should say. The medical field, as this is saying, we hear you, we see you, we understand what you're going through, and now we're going to try to help. Is there a change?
Absolutely. And I think also over time, the studies that, pretty much brought menopause treatments to a halt in the early 2000s have been now reviewed and analyzed and subanalyzed. And then more studies are coming, and different types of hormone therapy that were not used back then are coming out. So it is definitely having, again, like a spike in women becoming aware of it and asking for help.
Yeah. And the fact that I think women younger are also now going through perimenopause at an earlier stage, right? Everything I think is kind of shifting a little bit. So I think it's probably bringing more light to that. How much does stress have to do, though, with menopause, and it affects it?
Well, what it's known is that stress can definitely trigger your symptoms. So in other words, if you are very stressed and you're suffering already from hot flashes, a stressful situation or just feeling the stress could bring them and make them worse and more intense. Stress in itself, can it accelerate the onset of menopause? I don't believe that has been confirmed.
Okay, Dr. Diaz, do you want to chime in on that one?
Yeah, I think stress can compound a lot of things. And so if you're having these outside stresses, that are also impacting your relationship, impacting your body in a negative way, it's something that can certainly make it worse and something to address. So we can not only manage your stress better, but how can we manage the symptoms that are being developed because of this?
And can I just say that stress looks different for everyone? What I find could be non-stressful is probably extremely stressful for someone else. And I think women in their 40s, because you had kids later in life, you're in the thick of it, as they say, as you're raising a family. So that stress combined with going through all this bodily change that's happening in your life can all just seem a little bit different to kind of tackle. And then it's right in front of your face. But can you still get pregnant while you're going through perimenopause or menopause at all? Is this perimenopause, I should say, should really be it, right?
Right. You can. Absolutely, yes.
That'll add more stress to you if you weren't thinking it could happen, right?
Yeah, as a matter of fact, it's recommended by all the guidelines that you should use a form of birth control at least a year after you're in menopause, just to be, more cautious if you are not desiring a pregnancy, which, it would be the plans for most women already going through menopause. And when they start missing their period, they might even get concerned. Could this be a pregnancy or could this be perimenopause? The irregular cycles that happen during perimenopause also can confuse, like there's no way of tracking it and knowing when you have your days where you're more fertile or not. So it's, give you peace of mind to have a contraceptive method.
If you have a contraceptive method as birth control, does that actually help or not help?
It actually helps. It helps most people because, again, they're having all this unpredictable bleeding on top of symptoms like hot flashes at night or night sweats, and a hormonal contraceptive can help you with all of that.
This has been very insightful talking to both of you. But before I let you go, I really want to know what would be your takeaway that you want for anyone that's watching right now that's either in perimenopause or thinking that they could be or in menopause. We'll start with you, Dr. Angel.
I think the takeaway is that if you, and like Dr. Diaz had said, you know your body, and when you start experiencing all these changes, educate yourself. The more you educate yourself and find legitimate sources for that, that empowers you and you can advocate for yourself. There is fortunately many options nowadays for treatment. And if you are educating yourself, then you can make a decision what's going to be best for you.
Yeah, and I think start the conversation early. Don't wait until the symptoms become so bad that it's having a negative impact on your quality of life and your relationships. And medicine has evolved. I mean, we're talking about this today. And so there are people who specialize in this. And so perhaps your OBGYN may not be the most experienced with managing some of these perimenopausal or menopausal symptoms. They now specialize in menopause. There's additional education for them. We have sex therapists. We have pelvic physical therapists that can help with these. These are all new fields in medicine. So start the conversation, and hopefully your provider can either guide you through this or get you to someone who really specializes in managing these symptoms.
Can I tell you both? The worst part of it all is probably the hot flashes when you're just sitting and you're just sweating and you can't control it. But there's light at the end of the tunnel. So thank you to both of you for being here, for sharing all your insight, and for really having a great conversation. And thanks for all the audience out there watching. Remember, viewers, be sure to hit that subscribe button on our channel here to keep up with the latest health and wellness information and tips from our experts. Thank you so much for watching. Be safe.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Baptist Health Talk is brought to you by Baptist Health, the warmer side of care.